What is an awake craniotomy for epilepsy, and how does it work? Imagine having brain surgery while you're awake and alert. It might sound unusual, but for some people with epilepsy, this approach can make a big difference. An awake craniotomy is a special type of brain surgery used to treat epilepsy when seizures come from a specific area of the brain. The goal is to remove the part of the brain causing the seizures while protecting the areas that control speech, movement, and sensation. This way, doctors can see exactly which parts of the brain are involved and avoid damaging critical functions. The process starts with careful preparation. The patient is given medication to relax and is positioned comfortably on the operating table. The scalp and skull are numbed with local anesthesia to prevent pain. To keep the head steady, a device called a skull clamp is used. Sometimes, the patient is sedated enough to be asleep during the initial steps but is awakened during the critical mapping phase. Other times, the patient stays awake throughout the procedure, depending on what the surgical team plans. Next, the surgeon makes a small opening in the skull, called a craniotomy, to expose the brain. The dura, which is the protective covering of the brain, is gently opened. Now, the real work begins. While the patient is awake, they are asked to perform simple tasks like speaking, moving their limbs, or answering questions. The surgeon stimulates different parts of the brain electrically to see which areas are responsible for these functions. This process helps identify the regions that must be preserved and the areas where the seizure activity originates. Once the epileptic focus is pinpointed and mapped out, the surgeon carefully removes or disconnects the tissue causing the seizures. Throughout this process, the patient's neurological status is closely monitored. Medications are given to prevent seizures during surgery, and the patient's comfort and cooperation are prioritized. After the seizure-causing tissue is removed, the dura and skull are closed back up, and the patient is taken to recovery. This approach is especially helpful when the seizure focus is near important brain areas that control speech, movement, or sensation. It allows surgeons to tailor the operation, aiming to reduce seizures while maintaining the patient's quality of life. Sometimes, this surgery is performed after other evaluations, like non-invasive scans or invasive monitoring with electrodes, to make sure the surgery is as precise as possible. Of course, like any surgery, an awake craniotomy has risks. Not everyone is suitable for this procedure. Patients must be able to cooperate and stay calm during the operation. There is a small chance of seizures happening during surgery, but these are managed with medications. Some people might experience temporary symptoms afterward, such as numbness or mild cognitive changes. Recovery usually involves a hospital stay and some rest before returning to normal activities. In summary, an awake craniotomy for epilepsy is a carefully planned and executed surgery that allows doctors to remove seizure-causing brain tissue while protecting vital functions. It offers hope for better seizure control and improved quality of life for many patients. If you or someone you know is considering this procedure, it's essential to work with a specialized epilepsy surgery team and discuss all options to ensure the best possible outcome. Always consult healthcare professionals for personalized advice and treatment plans.